Welcome. We're so delighted to have you here today. It is not September 29th. I don't know how that date got wrong. It is October 27th. But welcome to the Climate and Health Advocacy Bootcamp, brought to you by the Global Consortium on Climate and Health Education and the Medical Society Consortium on Climate and Health. We are in the last of our sessions today. Our session today is on finding your power, and this is really going to be a culmination of all the work that we've been doing together over the past month. So welcome. Just a quick reminder that all the recordings and readings are available on the website. The link is in the chat right now. So if you missed any of the prior sessions or you want to access any of the resources, we have that link in the chat for you. So feel free to bookmark it and we'll keep that live for several months. Just a couple of Zoom logistics. Please put all your questions for the speakers in the chat, and we ask you to keep your microphones muted just to prevent any disturbances. We invite you to keep your cameras on. We love seeing your faces. Helps us know that you're here and with us, and helps us judge, if you're getting what we're putting down. So thank you so much. So today our session is on finding your power. And we will be hearing from Nicole Duritz. She is the Director of Advocacy and Outreach at the Medical Society Consortium on Climate and Health. She has over 20 years of senior level nonprofit experience with management, strategic planning, and issue campaign expertise. She is really a communications leader with a track record of designing award-winning advocacy and learning programs that engage and empower target audiences. And Nicole will be joined by Beverly Harp, who is the Associate Director for Communications and Campaigns at the Medical Society Consortium. As the Associate Director for Communications and Campaigns, Beverly directs digital communications for the consortium and supports the digital team. She's also worked very closely with the growing state-level networks, as well as many other things. So thank you all so much for being here today, and I will turn it over to Nicole and Beverly.
I'm on mute. Hi, everyone. It is great to see everyone right now. We are very excited to be joining you. And I am now actually trying to go to the right place to share my screen. There we go. Hold on one second. And hopefully this is going to work. Excellent. Is everyone seeing my screen now?
Looks great.
Wonderful. So we're super excited to be having this discussion with you. As Cece just mentioned, the relational organizing discussion really is a culmination of the various sessions that we have had thus far. Because when you are building out your network, you're going to be using the skills that you learned. And if you hadn't been able to sit through all of these sessions, as Cece said, you can go back and watch the videos and read the slide decks. But part of your organizing your network is telling your story, letting people know why you're engaged, and using the messaging, using the language that we know works, and then finding your community. And these are some of the things that we talked about in sessions 1, 2, and 4. So we're really excited to get started. So I'm just going to go ahead and jump right in. So when we're talking about, see if that's going to switch. There we go. When we're talking about relational organizing, really, the general definition is bringing your sphere of influence to your community to push forward the issues that you're most interested in, and using those people in your community to, again, move policy forward. And so we want to talk to you about how you build that network, what are the key components of building that network, and then taking active steps moving forward. I'm going to turn it over to my colleague, Bev, who is going to talk us through a few of the next steps.
Yes. So why are you an especially good person to do relational organizing? So we know that the messenger is more important than the message in all of the communication studies we've done at the Center for Climate Change Communication. All sorts of social science tells us that the perceived trustworthiness of the messenger is actually more important than the message or the truthfulness of the message. And your knowing someone relationally really makes you a stronger messenger. meaning like your colleagues, your friends, those connections that you have, that makes you someone who is more trusted. But we also know that you are more trusted by being a healthcare worker, a health professional, a physician, a nurse, a PA, whatever role that you hold in the healthcare world. We know that you are considered more trustworthy than a politician or a lawyer or even a scientist. Our studies show that primary care doctors across a range of demographics actually rank as more trustworthy in talking about climate issues than like someone at NASA, which is just like really interesting to see how that shakes out. But there's a lot of perceived trustworthiness that you all hold. And really, in order to create political and policy change in the US, we have a lot of hearts and minds to change to really lead along in understanding that climate change is a major issue that will impact us and our health and our community's health, and it's something we can do something about. So just like, there are studies that show that children can actually really foster climate concern among their parents. And we've seen that. And just as that is true, the close relational ties you have with those in your life or your patients carry over the same reasoning. And so this is what Nicole and I have been talking about, just charted out in a nice infographic, that the way that change happens is that you, as a concerned individual who is educated and well-versed on climate issues, or someone, you don't have to be so well-versed. We know we run into a lot of folks in the mental health community who really feel like they need to be the expert, but all you need to know is that this issue really matters, and, to be able to share that with those in your life and bring them along on the journey and say, this is, concerning. And then we need to pressure our institutions by voting, by showing up to take action on climate. And then as those institutions act, that impacts the broader society. And then there's like a feedback loop once you have policies in place that are good for climate, where people are supportive of them. And then it changes our whole societal outlook on climate. And so, I think I personally, and I'm not a health professional, but I come up on this in my conversations with loved ones, like talking to my grandmother about climate change and climate policy, really supporting her to see the vision of what climate policy could enact. And I think, from her, I hear a lot of like hopelessness and kind of disengagement. And I get that from other members of our family. And sometimes I feel like I'm really able to bring a vision of, no, this is how, we live in a democracy. We have control over what our policies could be like. And that, the solutions offered in climate policy will actually be so amazing for public health. And we could create communities that are thriving and healthy. And I feel like I'm really able to share that vision in the conversations I have with my loved ones, and those meaningful conversations, are what really move us forward in political and policy organizing.
So jumping back in here, again, as Bev was just describing, to create positive change, we really do need to build those connections based on these shared motives. Again, that is where we really dip back into the storytelling work that we started this session discussing, this program discussing, because that makes people understand you and they trust you and they feel that connection to you. And honestly, that is the basis of relational organizing. It is about sharing your hopes and dreams with people that are part of your world, and then asking them to engage with you. So let's talk about mapping your network and building your list, because we all know that we need to bring more voices into this discussion in order to succeed. And so to have this conversation, we want to talk specifically about people who are in the health professions, in the professions that you represent here. Because again, as we've talked about, as Bev just mentioned a few seconds ago, we know that you have a good sphere of influence. You are trusted individuals. And so those trusted messengers can move more people. So we're going to do a little exercise. I'm going to set my timer on my phone for 90 seconds. And before we go anywhere else, what I want you to do is just write down, either type it up in your computer or write it down handwritten. Just for 90 seconds, we are going to write down and think about how many people we know that we might want to have a conversation with. So I am getting my phone started right now, and we're going to start. So on your marks, get set, go. Start writing. You can think of anybody and let's focus for this effort, for this 90 seconds, on people that are within your health networks. And I'm going to be quiet and let people write for a little bit. We're going to see where you get to. And I will also mention, while you all are writing, that relational organizing, that works no matter where you are. This crosses country lines, it crosses professions, and it's been very successful in a lot of organizing areas, and we'll talk about that in a second. So about 30 more seconds, we're going to give this for you to write down just a list of people that you think you could talk to. All right, so that was 90 seconds. I'm really curious if people will put in the chat, just write down your number. Did you write down 10 names? Did you write down 15 names? Was it 30? Or did you struggle and you just ended up thinking, oh my goodness, I'm not sure who I should talk to. And maybe you only wrote down 2 names, and that's fine too. So let's see. Lisa, can you let us know, what are you seeing in the chat? What kind of numbers are coming up?
We're seeing 12, 25, 20. One person wrote state officials, training coach, exercise partners, my church members, but I'm seeing somewhere between 20 seems like a very popular number, 10 to 20.
Excellent. Okay. That's great. I mean, that's a great number. So this next slide, I want you to think about, especially when we're focusing on the health area, your network are people that you're engaging with in conversations. And again, you can map out your network by thinking about circles of influence. Who influences you most? Who are you closest with? Who do you know where you think you influence them? So here's an example, just kind of a funny graphic to talk about different areas that you might want to explore. So this is, I don't know how many of you watched the show Scrubs in the 2000s, but this was a television show about a bunch of residents in a hospital. And the person in the center with the dark hair, that's DJ, and he was one of the lead characters, and another one of his colleagues, Turk, and one of his attendings, and again, and others that worked with him. And so we use this graphic just to kind of think about, where might you look? What about your friends in your professional societies? What about people that you went to medical school with, or friends from residency? You can also think about your health mentors. Maybe this was someone in your undergrad, a professor who was in your undergrad, or an attending, or a teacher, a professor at your medical school, other clinicians at your hospital or in your practice. I mean, those are some of the spheres that we want you to explore. And so if you take this first slide and then we move to this next slide, where you see all these little dots that are surrounding each of those different areas, you can see how you might be able to build out your network more broadly than you originally considered. Because there might be people that you have ongoing contact with, but you never thought of necessarily talking about it. And when I talked about the success of relational organizing, this really started there was a lot of efforts with the unions in get out the vote efforts, where they would have an individual map out their networks and go talk to the folks within their networks, urging them to register to vote and then to get to the polls. And it's been incredibly successful with a lot of those kind of, like I said, union organizing and other those types of professions. And what we're really trying to do is to push this idea within health sectors, to see how we can engage more health professionals in this kind of work. So there is a theory that's called Dunbar's number. And what we realize is that our networks are actually bigger than we might have originally thought. And Dunbar's number is a suggested cognitive limit of the number of people with whom you can maintain stable social relationships with. And believe it or not, that number is 150, which I think is pretty amazing. And these are individuals that you know, and that know you, and that you can relate to. You can identify. Like if you said hi to this person passing them through the corridors of your hospital or in your community, they would recognize you. And it's somebody who you'd be willing to have a conversation with. And some of those are very, very close relationships, and some are more distant, but nonetheless, those are the individuals that are within your network of influence. So again, another way to talk about this is looking at it as a target. You're in the center, and then each of these concentric circles that come out, they might be a little more distant from you, but they're still people that reside within your sphere of influence. So what we'd like to do, and I know this has been one of those sessions where it's kind of quick. We've been talking about how you can use this your network to take activity. And what we're going to do, and we really hope that people will participate in the breakout and then come back, because what we really want to talk about after we get back and after you've kind of built out your lists of who you can work with, we want to talk about what are some of the concrete next steps that we are going to take from this entire boot camp course that we've taken together, and then apply that to your networks. So as you're figuring out who you're going to talk to and who you're going to work with, what are the concrete steps that you're going to take? I'm hoping that as we emerge from these discussions, what each of you will commit to is having a discussion. You'll take one person from each category and reach out to them. As you have developed the story that you want to share with people, you will use that story in these conversations in order to engage more people in the work that we're doing. So what we'd like to ask you to do is to take 15 minutes. We're going to ask you again to move into breakout groups. And what you're going to see here is, this is an example of a chart that you could fill out in each of these categories. See if you can actually write down 10 people that are in your practice or in your work environment. And then think about the next level of your work environment. So for physicians or nurses or respiratory therapists, it might be folks that are within your health system or within your hospital. And then again, another category that we talked about are who are those friends that you may not be seeing every single day because maybe they took residency someplace else for med school, or maybe you've completed your residency and you're now attending somewhere, but you have those same connections, mentors, colleagues from medical societies or other groups that you're in. And then just the category of other. See how many names you can fill out when you're thinking about it in categories. And then we're going to come back together as a group, talk about what you heard, and share within your groups as you're making your list. Talk to one another about where you're grabbing your names from. Who are those those individuals that are part of your sphere of influence? Because as you're listening to your colleagues in the breakout room, my guess is it's going to spark some ideas that you might not have considered before. So let's go ahead and break out. We're going to spend about 15 minutes doing this. And then I really, really want to encourage everyone to come back, because I think one of the most powerful things we can do is talk about the next action steps that we're going to take following this session. So I think what I'd love to do is hear from you again. So again, maybe folks put in, now that you've gone through an exercise where you've really explored a variety of different spaces that you might not have originally thought about that might be in your network, can I ask folks again to go into the chat and just type in a number? Did your number go up when you thought about it in different categories? Was it about the same? Did folks that were a part of your group, recommend some groups that you might not have thought about yourself? And where are the different places that people thought about to go and reach out? We gave you some suggestions, but I'm really curious to hear from folks. And you can take yourself off of mute or raise your hand and we'll call on you, just to kind of hear about where you all were looking to build your networks. I noticed that one person in the chat wrote that their number went up by a couple. Somebody went up to, has 45 as their number, which I think is the highest that we've seen thus far. So I'm really curious if folks are willing to share a little bit about how they created, where they looked for their networks, and the types of people they're going to reach out to, and what their experience is. Ruthie, I see that your hand's up. Why don't you come off mute and let us know?
Well, after thinking about it and listening to someone else, my people increased because I thought about my church group. And I'm a retired RN, and we have a retiree meeting every quarter. So I could talk with them. I had not even thought about them until, started listening. And I volunteer at a high school. I'd go to one of the science class. So I could use that opportunity to talk to young people about climate. It had not entered my head until you gave us a list of things that we could start doing. And also my family. I'm on a family, we have a family Zoom meeting once a month. And they're kind of a captive audience. I can tell them about it. And I had tried with neighbors, and I said I'm gonna try again on my walk when I meet my neighbors and talk to them about climate and what they think. It didn't go over well the first time I tried it, but I can try it. Thank you.
Well, and now, thank you. This is great. I mean, I think a lot of folks think about their faith groups, their family groups, their neighborhood groups. I love the fact that you're volunteering in a school and asking to have a conversation about climate in a science class. I mean, that's a great idea. That's wonderful. I'm glad to hear it. Is there anybody else who would like to share what their experience was and how they were building their lists? I'm looking to see if I see any hands going up. Okay, come on, don't be shy. We've been together for a couple weeks now.
My list actually went up in listening. So how the list expanded? Because I actually have a background in accreditation and quality assurance, and I never really even thought of reaching out to that community also, because that community also has access to all of the higher education colleges. And even then amongst colleges, there's like a connection and a community called the Caribbean Area Network for Quality Assurance in Tertiary Education that I was actually the former secretary of, that I didn't even think about as a place or a space for discussing climate or health impacts and things like that, because, it was a network that was there, but I didn't even think about it until one of the colleagues actually started to talk about her experience with her students at her college. And then I realized that maybe even at that platform is an opportunity to even promote, student learning in this sort of way by promoting credits going towards the service learning and the work in the communities that have an impact on climate, environment, and disasters and things like that. So sometimes it's just how these connections are actually made. It's really funny.
Absolutely. And I think also sometimes it's the act of writing it down or typing it out, as opposed to just kind of thinking in your head, when you're actually kind of putting names to pieces of paper, it'll spur a bunch of different ideas. I think I see one more hand, going up. Why don't you go ahead and take yourself off mute?
Okay. Hi. Sorry, my network is a little shaky, so I may not be able to put on my camera. So I was limiting myself initially to thinking around just people in my workspace, and I was like, okay, I already work in climate change. I'm not working in health. I already work in climate change. I already do advocacy, so people around me know it. So that's why my number was initially. But thinking about it in groups, I realized that I'm I'm on the groups for my old students association. I could speak to them about that. I have a large family. I could speak to my siblings, their spouses, my cousins about it. I'm in an exercise group. I work out with a large number of people. I could speak to them one-on-one about it. And then, yes, I transmute. Yeah, I move from work home, and that's at least 10 different drivers a week. So I could always bring up the weather because we're experiencing floods in Nigeria. So I could always bring up the weather and then strike up a conversation from there. So that's how my number went up.
That's excellent. Is there anybody else? And what I'm hearing in these conversations really guides me to what I think about relational organizing. It's organic. And so when you're having a conversation with somebody, you may end up having, and we're going to talk about this next, but you may end up having 10 conversations. And if in those 10 conversations, maybe you have 10 conversations in your faith group. And of those 10 conversations that you have in your faith group over the next, month or so, 3 people might say, wow, that's really interesting to me. I want to learn more. And then those 3 people start having conversations. And then you tell them, I took this boot camp and learned a lot of information. Here's the link. And they go on and they watch the videos or they read some of the slides, and then they have 2 conversations. And that's how we're going to really grow and sustain this movement. And again, so that kind of brings, well, let me stop there for a second. And are there any other folks that want to talk about different groups that they identified that they want to talk to or building their lists? And I don't see any hands up right now. But if someone wants to share, we're all eager to hear, because I think I saw a lot of nodding as the folks that came off mic were talking about the groups that they were looking to explore.
Hi, everybody. My name is Amira. I'm a resident. And so one thing we discussed was reaching out to medical students. It looks like I dropped it in the chat, actually. There is a National Medical Student Alliance for climate change and healthcare. However, a lot of us, if we work in hospitals, are associated with a medical school, and medical students these days are very, very eager to do extracurricular work and research. And so I think it would be, a really great place to reach out to and foster mentorships.
That's wonderful. I was just talking with my colleagues at the start that I was in a meeting. In the US, there's a group called Medical Students for a Sustainable Future. And I just had an hour-long conversation this morning with 2 of the leaders of that organization. And then we're also working with AMSA, which is the American Medical Students Association. And I believe that there are, I assume, and please tell me if those of you who are not in the United States but are joining us from other nations, if there are national medical organizations, if you have a student chapter, those are great places to reach out. One of the discussions that we had is, early career physicians and medical students love the opportunity to make connections with physicians that are at a different place in their career as a mentorship. And also the person who is in a different place in their career learns so much from the medical students, and that shared communication and shared passion, especially around climate, we can really build from that. So let me stop one more time and just see if there's anybody else who wants to share an idea. And if not, what I'd like us to spend some of the remainder of our time focused on is, what are some concrete next steps? So again, just as it is, I'm sorry, Suzanne, I see that your hand is up. Why don't I stop and go to you?
Hello, everybody. Well, actually, this is my first time of coming into the group, the first time, and I'm so sorry I couldn't attend all the others because I had some different medical things going. At the moment, I cannot put on my camera because I had eye surgery. Anyhow, our group wasn't very, it was only two of us that really spoke. Nobody else spoke. So Zoe and I spoke and we exchanged ideas. And most of what everybody else has said, we also said, but what I think I can add to that, like the social services, the non-governmental organizations. I'm from Antigua, that's in the Caribbean. The non-governmental organizations, and listening to the others' report, I didn't even remember about the church, which is very bad of me because I'm a stalwart in my church, and I teach Sunday school, so of course you can start teaching the children young, and they're never too young to learn, and also the family. And with the family, your mates, that your workmates and that sort of thing. And, just go from there. So a little of what everybody said, I wouldn't reiterate what they said, but just that I'm glad that somebody else shared. So I got some additional, and from what I'm seeing now, my list have gone up a lot because I'm an administrator in the Ministry of Health. So I have touched base with almost every other ministry or department in the government service. So that's a good thing. And I have it's like I have a team then for myself, a team that I can always call and, talk to. And I'm in charge of the clinics, the government clinics and the institutions in the government. So I'm very happy that I came in, but very sad that I didn't join before.
Well, we're happy that you absolutely. And we're happy that you joined us today too. And good news is we are going to be sending out, we'll post a link again in the chat so that you can access all of the sessions that you may have missed. They've all been recorded and the decks are all available. And we would encourage everyone, if you missed a session, it's a great opportunity. If you want a refresher, it's a great opportunity just to go back to those sessions, and you can learn about the conversations that happened also. So what I really do want to focus on is, again, as I said, some of those concrete next steps. Now that you've participated in, this is week number 5 of this training, and whether you participated in 2 or all 5, or this is your first session, where do you want to go from here? How do you want to apply what you've learned? How do you want to reach out to the folks that are part of your network? And I think, again, and maybe this is just me, but when I commit it to paper, or computer about what my next steps are and the timing of when I'm going to take those actions, I am more inspired to do that work. And part of the session that we talked about last week, finding your community, this work can be hard. We have had some victories in the United States recently, but we've also faced a lot of challenges. And I don't know intimately in all the other nations that are joining us here, but in the climate work, I think we all see a lot of the same challenges and also the opportunities. And so finding your community, engaging those people that you work with, that you are friends with, that you share faith with, those connections can help sustain you in this work. But again, it is work. And so I'll throw some ideas out there. How many, and you people can raise your hands, you can put it in the chat, you can come off mute if you'd like to. How many people think that they can commit to having 5 conversations in the next 30 days? And, for those of us in the United States, Thanksgiving's coming up. And, I know there's things that you're not supposed to talk about at the Thanksgiving dinner table, religion and politics, they always say. But I don't think most of us would say that, climate is not a political situation. It's something that affects us all. So, how many people think that they could commit to 5 conversations in the next 30 days? I'm seeing hands. For those of you who are on camera, I'm seeing hands go up. If you're off camera, if you put your thumbs up. And from those conversations, think about this, because we're going to be asking you, we've talked about a survey that we're going to share with you. And one of the questions that we have in the survey, or some of the things that we want to hear from you, is what else do you need from us? In the documents that are part of the presentations, there were a lot of resources. So we've talked about having conversations. Do people feel that they would be comfortable taking another step? If you've had a conversation, would you follow it up with an email with some resources so people can educate themselves? I see Barbara Ernie is saying that Thanksgiving is a great opportunity. I agree. People are sitting around the table. They're eating. They may be having a glass of wine. And it's a great time for conversations. And these things don't need to be polarized. These are just conversations talking about things that are important to us. I see there's some hands that are up, and I'm not sure if you want to come off mute to contribute. Please do. Or if it was just a hands up to say you're willing to make the have the 5 conversations. What are other things? And this time I am going to ask folks to come off mute. Raise your hand or just come off mute. What are some other next steps that people think that they might want to try? You know, in the United States, we have an election coming up very shortly. You know, some people may take a next step of, you know, volunteering to drive someone to the polls, or to share some conversations that, you know, we learned about Vote ER and some of the resources that are available through Vote ER. But what are other things? You know, maybe you want to explore your community. Maybe you're going to sign up for an email list. Or join in the United States with Medical Society Consortium. We have a variety of state affiliate organizations. So maybe you will reach out to somebody in your state or in your local community to work with. So I see Joseph, you have your hand raised. Come on off mute.
Yes, good evening to and good whatever time of day. What I can say I'm doing is that wherever there's an opportunity to learn more about climate change, I'm making it available to other people. For instance, there's a new series, Caribbean series, starting with Colombia tonight. And I've shared it extensively with many people here in Grenada and in the Caribbean. So I hope many more will join. So the whole thing about it is making climate change and its potential effect every day, all the time. In other words, it has to become the air we breathe, like the air we breathe. It must be factored in and considered always, not just as it used to be, you know, casually or sometimes, you know. It must become entrenched in all that we do. So I am doing everything I can by making people know what's available and how they can learn and how they can contribute.
That's fantastic. And Haley's been putting the links in for that new session in the chat. So please check that out.
Yeah, and I'm from Grenada.
Fantastic.
Thanks.
Thank you so much. Hannah, I see that your hand is up also.
Yeah. So a few of the next steps I want to take are one, just exploring different like physician groups. Somebody in one of my groups had mentioned physicians for social responsibility. And then like thinking about also like New York ASAP and just kind of thinking about different physician groups that have chapters in New York that I can like explore and see if I'm interested in joining. And then I want to talk to my coworkers, because when I was creating my list for like the coworkers that I work with in the emergency department where I work, I'm not actually sure who's interested. So I think I just need to bring it up in conversation more often. And also just, you know, talking, I definitely want to also bring it up to more family and friends. I have like a bunch of social events, Thanksgiving coming up, that I can definitely try to do that during. And then the other thing that I am, I was motivated, like, since this boot camp has started, to like really look more into climate action or advocacy that's going on in the area where I live, which is downtown Yonkers. And there are a bunch of things going on. There's like, there are going to be public hearings coming up. The first one is next week on like the Yonkers climate action plan. So I want to go and I want to be prepared to actually like, you know, contribute and meet people and see how I can get more involved.
That's fantastic. And we've also heard of physicians that have kind of worked on green rounds as a way to kind of talk about the connection between climate and the work that they're doing. I actually, not last year, but in 2021 at our annual meeting, there was a discussion about the connection between the experiences of emergency docs and what they're seeing and the impacts of climate change. And that's something that you might be interested in finding on. We can put the link in our website to that part of our website. You could watch the session. And I think that's a great way to kind of raise those conversations. I think everything that you've described is wonderful. Ashatu, and I hope I'm saying your name properly. Why don't you come off mute?
Yes, you are. Thank you, Nicole. Yeah, so two things. In Nigeria, we're having elections, and for the first time ever, climate change is getting into the conversation. Two leading presidential candidates have been asked about climate change, and their answers have sparked a lot of debate. So I commit to making a weekly post on the upcoming election and climate change. And secondly, when I was in my group, I spoke with Dr. Musa, another Nigerian in the group, and he works in the Northeast, where they're experiencing a lot of flooding. And even from the conversation, we agreed that, okay, we'll have a webinar where we'll discuss the diseases that are coming up. Climate change and health are coming up as a result of this, the current flooding we're experiencing in Nigeria. So those are two things I'm committing to.
Fantastic.
Thank you.
Fantastic. Zoe, would you like to come off mute and share with us?
Yes, I hope you all can hear me. So I just wanted to, share another opportunity for folks, and this could even be if you're out of the US. So right now, at least in the US, there's an opportunity, there's an RFI or request for input and comment on a greenhouse mitigation resource. And so as part of the Justice 40 and environmental justice resources that will be coming out of the Inflation Reduction Act. And so the point of this is, I think that when, state or national governments announce public comment opportunities for how, public dollars will be used, I think that that's really an important strategy that we can all, earmark as and always be prepared to as an opportunity to advance the outcomes that we want to see. There's a blog that's for luxury and it's called How to Spend It. And so what I'm pitching is like, we need to actually, start, breaking health opportunities to not be a luxury and disrupt by actually guiding our, those who are kind of more in a fiscal capacity of how to spend it so that we can all afford health.
That's fantastic. Anybody else that would like to share what they think they're going to take as some next steps? And there's no next step that's wrong. You cannot step wrong. If you're saying that you're going to sign up for a list and read and learn more, that is a fabulous next step. If you're at a point where you've been, there's a lot of names in here that I am familiar with based on my work with the Medical Society Consortium. And there's some folks here that have been leading and that has been amazing because they're moving their organizations forward. And so maybe they're going to take another step. They're going to continue speaking out. And that's fantastic also. There is, as Bev and I talked about last week, there are lots of rungs to this advocacy ladder, and no rung is wrong because you're going to be moving up and down your level of engagement based on where you are in your life, where you are in your career, and maybe you're just tired. Sometimes we get tired and that's okay too. So you might step back a little bit. But what we want to encourage you is always to find something that you can do to engage in this work and to engage others in this work. We need to continually replenish and grow our community in order to move our policies forward. And that's a lot of what we've been trying to do here in this boot camp is to provide some skills and training and mostly provide some support for your interest and the work that you're doing. And so with that, I want to turn it over to my colleagues that who we've been organizing the session with to see if there are things that you wanted to add or next steps. And really thank everyone for sharing what your next steps are. We can't wait to see where you go. I don't know
Great.
if Lisa or
So there-
Cece.
Yeah, there are two sort of, if you want to stay in the know for our two organizations. So Columbia's Global Consortium on Climate and Health Education, Haley's dropped the link to join their newsletter. And then I've dropped the link to stay abreast of what we're working on at the Medical Society Consortium. We offer advocacy trainings, media trainings, and then we have an annual meeting coming up in March. Anything else you want to add, Cecilia?
Yeah, I just dropped the link to join the Global Consortium on Climate and Health Education in the chat. We are an organization that is really focusing on how to infuse this type of work into traditional health professional training institutions, as well as in health societies. And so if you're interested in that kind of type of work, we welcome you to join us. We'll also be offering a lot more training courses this spring, thinking about how we can further use our knowledge, our skills, and our expertise to move these issues forward. So we welcome you to join. I also want to do a quick flag that we're going to put a link in the chat right now for a survey. We'd love to get your feedback on this boot camp, how we can improve it in the future, any ideas you have, and just get some feedback from you, hear from you, because we're always trying to do things better. And so we really appreciate your feedback. Thank you.
Thanks so much, everyone.
Thank you.
All right. Thank you, everyone. Take care.